Greetings and welcome back. You've been in the grocery store recently, you've noticed exotic berry juices being exploded into the American food supply. Foods such as mangosteen, acai, and goji berry have caught the attention of the American consumer. Well, are these functional foods worth the extra money, or would any dark blue or purple juice be just as good for less money? We're going to explore that a little bit in this lecture on functional foods. Many consumers believe that food is medicine, and as a dietitian to a certain extent, I believe it can be. Foods are designed to nourish us, and part of that nourishment should be wellness focused. However, consumers must be educated on what foods are really worth the extra punch that they seem to be packing. And foods that you might have heard of, these foods are called functional foods. In the beginning, functional foods were thought of as preventing deficiency diseases. Yet today, functional foods have taken on a whole new meaning. So this lecture is going to explore the definition of functional foods, give you some examples of popular functional foods. We are going to explore some of the terms used in functional food marketing, and then take a look a little bit at the regulations and policies regarding functional foods. So, let's start out with a definition. You have to know that there is no legal definition of the term functional food in the United States. So there's no governmental regulation saying a functional food must be defined this way. But it's rather more of a marketing strategy than it is a regulation. Well, my professional organization, the American Dietetic Association, has a definition, and a functional food is a food that moves beyond necessity to provide additional health benefits that may reduce disease risk or promote optimal health. Now, we've got some functional food categories to explore. There's going to be foods that are conventional, foods that have been modified by the manufacturer. A manufacturer has added in a functional ingredient. Certainly there are medical foods that would fall into this functional food category, and foods for special dietary use. So let's start out with a whole food approach. Let's take a look at conventional foods that are unmodified. Well, research has shown that fruits and vegetables were the top functional foods identified by consumers. In part, this is because fruits and vegetables have compounds and pigments with a high antioxidant capability. Now, there is a scoring or a ranking system called ORAC that gives a number to a food based on its ability to scavenge free radicals. Keep in mind what we're looking at here is we talk a lot about antioxidants. Their job is to scavenge or attack these free radicals and neutralize them. ORAC stands for Oxygen Radical Absorbance Capability. So it's given that term ORAC. And again, you can do a Google search on the internet and you can find ORAC ratings of foods. Now, when we look at the ORAC rating tables, spices score high on this rating, but I want you to think about this. The amount that you use is so small that it adds little to the antioxidant intake. So again, it's not that they're not powerhouses in terms of the ORAC rating, you just don't use enough. But given typical servings, my favorite foods such as dark chocolate, apples, pomegranate juice, all add relatively more to the antioxidant intake. But all fruits, vegetables, nuts confer antioxidant capabilities. So I want you to think about this. You're going to the grocery store and you're thinking, should I spend the significantly higher premium on an exotic juice, or could I get something else that has a similar ORAC score? So I would encourage you to look at the ORAC scores of foods, again, if you're going to spend a significant amount of money. So we can now take a look at examples of real foods with functional benefits. Cruciferous vegetables, such as kale and broccoli, are part of the reason why plant-focused diets are needed for cancer prevention. Naturally, they contain foods that have a significant functionality to them, and there is reduced risk of several types of cancer. It protects against carcinogenesis in experimental animals and has been shown effective in the management or prevention of stomach cancer, cancers of the esophagus, mammary glands or breast cancer, skin and lung. There are numerous studies pointing to the need for increasing all fruits and vegetables. So again, a key point for consumers is don't follow the new functional food of the day, because I will tell you next year it's going to be a different fruit or a vegetable. So always think more fruits and vegetables. All fruits and vegetables are going to have a relatively high ORAC score, and I might want to include all of those. So is there another group? Well, let's take a look at tomato products. Lycopene, which is part of that red pigment in tomatoes, has mixed effects in reducing certain cancers. As I mentioned before, large epidemiological studies show a relationship between low levels of lycopene in the blood and prostate cancer, but studies have not demonstrated the prevention of prostate cancer with lycopene. So the FDA looked at this and said there was little evidence to support an association between tomato consumption and the reduced risks of prostate, ovarian, gastric, and pancreatic cancers. However, study results are still positive enough. There's an association that's developing, not necessarily cause and effect, but an association developing that's enough to say increase your risk increase your intake of tomato products. Now, what about citrus fruit? Citrus fruit may reduce the risk of stomach cancer, and again, it has functional ingredients in citrus fruit that confer that benefit. One study showed a 28% reduction in the risk of stomach cancer was associated with a high intake of citrus fruits. Pooled results from observational studies show a protective effect of high citrus fruit intake and the risk of stomach cancer. So again, if you don't incorporate citrus fruit into your diet, it now might be a good idea to do so. So again, things like oranges would be a great example of a citrus fruit. Certainly in this functional category are fermented dairy products. Yogurt and other fermented food products have been shown to improve the symptoms of irritable bowel syndrome. Studies show that the short-term effects of IBS may be improved through the use of antibiotics and then treating and using probiotics for symptoms. Probiotics are a great example of a functional food. And again, in our conventional food category, they are there naturally to ferment the yogurt. However, there's caution here. The addition of probiotics to foods where they do not naturally occur may reduce their effectiveness. So you go to the grocery store and you hear all about probiotics, and you know that it occurs in yogurt naturally. But now you see probiotics being added to a dry food like a cereal. You have to ask the question, when I've removed it from its parent compound and dumped it into a different food where it doesn't occur, is it going to have the same effectiveness? And I think that's a consideration as we look at this functional food category. Generally speaking, if IBS can be caused by bacterial overgrowth, then killing the bad guys with an antibiotic and then turn around and replacing them with the good guys, a probiotic, may be an effective strategy. More studies are always going to be needed to prove these results for digestive conditions in the future. But again, if you're looking for a great source of a natural probiotic, think fermented foods. Another food that gets a lot of press as a functional food is cranberry juice. And again, I'm going to caution you that taking the active ingredient in cranberry juice, which we'll explore in a second, and dehydrating it and putting it into a pill may not have the same kind of beneficial effects. So there's a lot of dried fruit and vegetable products that are on the market that you can mix in with food, but remember, there may be a change in the functionality of that ingredient when I change its form. Certainly, we've read and heard about that cranberry juice can reduce the amount of bacteria in your urine. And so how does this work? What is the active ingredient? The proanthocyanidins, or the dark red pigments in cranberries, have been shown to inhibit the docking or the binding of bacteria in tissues in vitro in a test tube. So basically what it does, it prevents that bacteria from binding and proliferating in the bladder and reducing the risk of a urinary tract infection. The use of cranberry juice and extracts as an agent against recurrent urinary tract infections is well documented in women. So if you are someone that is prone to urinary tract infections, this food may be a valuable adjunct to your diet. Now again, keep in mind that cranberry juice is a pretty high calorie source. So indeed, if you're trying to do two things at the same time, you're trying to prevent urinary tract infections and control your weight, look for a reduced sugar version where you're still getting the wonderful red pigments, but you reduce some of the sugar. Now we have another category of functional foods called modified foods. These are those that are modified through fortification, enrichment, or enhancement. So they've taken a conventional food and they've added something with, again, that functional food enhancement to the food to improve its overall nutritional value. So let's look at some examples. Calcium fortified orange juice is a great example. They've taken a food where calcium doesn't normally reside, orange juice, and because it's a popular breakfast item, they've added calcium to it. And again, that's a great example of a modified food that's been, again, enriched with some additional calcium. You can also see vitamin D being added to orange juice as well. Certainly folate-enriched breads. Now, part of that is mandatory by the federal government, but again, manufacturers can add more folate to breads and again, increase their nutritional value. One of my favorite ones in this category are actually margarines that have been enhanced with plant stanols or sterol esters. And what these actually do is they prevent the absorption of cholesterol from your gut. So these stanol or sterol esters bind to the cholesterol receptors in your gut and prevent the cholesterol from being absorbed. So this is a really nice example of taking an ingredient, a stanol or sterol ester, putting it in a margarine, and now again reducing cholesterol. There are certainly beverages out there with ingredients to promote energy, and we've all seen the energy drinks on the market, things like ginseng or guarana, and guarana actually is a caffeine source. Or they might add taurine, and taurine is an amino acid. So they're taking these compounds and actually just enriching or adding an ingredient to provide additional energy. So what do we know about the research on calcium fortified orange juice if we're going to explore this one in a little bit more detail? The bioavailability of calcium from different fortification methods was tested in calcium fortified orange juice. Results indicate that the calcium content on the labels doesn't necessarily indicate the amount of calcium that's absorbed. And this is a problem with most minerals. Just because it's on a nutrition facts panel or just because it's in a nutrition database on your computer doesn't mean that's exactly how much you absorb. So the challenge is, the conclusion of this study is the information on bioavailability of fortified products should be provided to educate the consumer on the actual amounts of the nutrient they're receiving. Now, controversial topics regarding functional foods include those that are genetically modified. This is using biotechnology to modify the food to improve the nutritional value and hopefully the health. Okay, so let me give you a couple examples. The first comes from tomatoes. There was a type of tomato called Flavor Saver, and this was one of the first genetically modified foods introduced into the American food supply in 1994. The purpose of this genetically modified food was to improve the flavor, the shelf life, and to even reduce spoilage. So this is an example where the food was modified, so again, consumers would enjoy the flavor or the tomatoes will last a little bit longer, either at the grocery store or in their refrigerator. Now, keep in mind as we start talking about these genetically modified foods, we have embraced genetically engineered hormones such as insulin and growth hormone. Certainly when insulin was first discovered, there are 2 amino acids different in pork insulin than human insulin. And so we've now gone in and genetically modified insulin to make it bioidentical to human insulin. And some of the consequences of pork insulin obviously have been eliminated. And for those who have diabetes and must take insulin, this was a real boon. But when it comes to food, consumers are skeptical and have not embraced genetically modified foods. And in terms of the Flavor Saver, the product is no longer available for sale. But as we think more globally about nutrition, golden rice is a great example of taking a look at worldwide poverty and worldwide malnutrition and genetically modifying a food. Golden rice is a rice that's modified to contain higher amounts of beta-carotene, that precursor to vitamin A, to implement in developing countries where vitamin A deficiency is a problem. Vitamin A deficiency is one of the leading causes of childhood blindness worldwide. So adding beta-carotene to a non-perishable food is one of the best outcomes of genetically modified foods. And again, if you think about it, beta-carotene is going to come naturally from carrots and cantaloupe and anything that's going to be orange in pigment. Well, these are perishable foods, and so we cannot airlift in to regions of the world where starvation is prevalent. We can't airlift in perishable foods. So golden rice is a great example of a genetically modified food. And it is used by relief organizations now in developing countries. And again, it can contribute to the eradication of vitamin A blindness. Another category that we're looking at is medical foods. Now, medical foods do have a definition, and they're defined by the Orphan Drug Act. Medical foods are a food which is formulated to be consumed or administered enterally. Now, technically, enterally means by mouth, but in this case, it's really implying a tube feeding, under the supervision of a physician, and which is intended for the specific dietary management of a disease or a condition which has distinctive nutritional requirements. And this is going to be based on recognized scientific principles and are established by medical evaluation. So again, that's a long legal definition, and basically what it's saying is that they've modified a natural food to provide unique nutritional balance for someone who may have a disease that has different nutritional requirements. So examples might be oral supplements that are designed for specific medical purposes, such as increased need for arginine in wound healing or preventing muscle breakdown in cancer. We also have a category called foods for special dietary use, but they really don't require any medical supervision. This is a particular use for a food that's purported or represented to be used, and things such as infant foods would be a great example of foods for special dietary use, gluten-free foods, foods for special dietary use, lactose-free, and foods that are being offered for reduced weight. Again, these are foods that don't have to be used under medical supervision. Okay, let's have a little focus on consumers now. What do consumers believe? 85% of consumers believe that certain foods may have health benefits that are going to reduce the risk of chronic disease or other health concerns. It's again that belief that food is medicine, just like Hippocrates taught us centuries ago. There is an increase in consumer awareness of their own health and healthcare costs. Evidence-based science is emerging, linking diet to chronic disease reduction and other health problems or concerns. Certainly, there's a striving for a personalized approach to nutrition and the new wave of the future, food for the treatment of health conditions. Well, do we have any regulation of functional foods? Now, certainly the primary goal of the FDA is to provide information on labels to consumers about their diet and health. But there is no specific regulatory framework for foods that are being marketed as functional. This movement is just too new. Now again, keep in mind, however, if a claim is made, a drug claim is made, for example, a company that is marketing functionality would be prohibited from saying cranberry juice prevents bladder infections. They can't say that. But again, as long as they're just marketing or advertising that cranberries are a great source of these wonderful plant-based pigments, again, they're not going to be prohibited from doing that. So it is confusing for the consumer to sort through the information and decide whether it's accurate or not, or is it worth the additional money? This is because claims for the health benefit, things such as now a low glycemic cereal, or contains resveratrol, which is going to be found in red wine and grape juice, or enriched with DHA, an omega-3 fatty acid, is on the front of the package labeling. It's not a part of the food label. And again, defining the nutrient. So again, if I'm going to the grocery store and I see a margarine that says now has stanol esters, all they're doing is defining a nutrient that's in the food that's not required to be part of the food label. And again, defining a nutrient and making a health claim are distinctly different claims on that front of the package. A survey has found that consumers regard the scientific evidence and other positive aspects of the product containing an unqualified claim similar to those that have an actual qualified valid structure function claim. What does this mean? This means that the average consumer can't tell the difference between fact and fiction, and this is why consumers need to understand the concept of a qualified health claim. And it's also why the FDA must scrutinize the claims as well. So again, if a company is going to make a claim, a qualified health claim for a food, the FDA will step in and make a claim or make, again, some kind of ruling on it. The challenge is, again, if I just define the nutrient that's being added and stop short of making a claim, there is no governmental regulation. So currently, there are 3 claim categories that can be used, and some we've explored in other lectures. There's certainly the nutrient content claim. Claim on a food that directly states or implies the level of a nutrient in a food. However, this doesn't make it a health claim, but rather states the nutrient content. So things like low fat, reduced fat, sugar-free are all examples. Certainly, there can be a structure-function claim. It gives the role of a nutrient or a dietary ingredient in affecting normal structure or function in humans. However, there's a key distinction that has to be made here. A structure claim does not imply disease prevention. So for example, this structure function claim could be something like calcium builds strong bones. That is true. But they cannot say calcium prevents osteoporosis. Certainly a company can say fiber enhances bowel regularity. True. But they can't make the jump to a disease. Fiber prevents constipation. Certainly conventional foods and conventional food manufacturers are not required to notify the FDA about their structure function claim. For example, milk ads can claim calcium benefits of milk. Health claims on food packaging, and probably there's going to be more controversy seen in this category. Health claims are ways to entice health-seeking consumers to purchase foods, and so companies are routinely petitioning the FDA regarding a new qualified health claim. So again, if a consumer really wants to know, if I buy this product, can calcium prevent bone loss? Can it prevent a disease? And so when the Nutrition Labeling and Education Act was passed in 1990, the FDA initially authorized 7 health claims on foods. Manufacturers today can petition the FDA for any health claim that the company believes is valuable. And the key point here is that the current science is going to support. So a sample of such claims would include calcium and osteoporosis, sodium and high blood pressure, fruits and vegetables and cancer, folate and neural tube defects, dietary sugar alcohols and dental caries, and soy protein and heart disease. However, to make this claim and have this appear on a package, the companies have to provide, and the FDA has to review, the strength of the evidence for the claims that are based on all studies that are significant, as well as expert opinions in the field. Things such as clinical trials, meta-analyses. So again, it can't be that one study suggested that calcium promotes body fat loss. There really has to be the strength of evidence through a clinical trial or a meta-analysis, 2 very rigorous research design tools, to say, yes, the strength of evidence supports this. Certainly they can provide in vitro and in vivo studies as well. Numerous literature reviews and searches on well-known and reputable studies related to the topic. So when you see these kinds of claims on packages that says 25 grams of soy protein can aid in the reduction of cardiovascular disease, please know that that manufacturer, as well as the FDA, partnered to review the strength of evidence to say, I can actually make that claim on food. Some of the petitions submitted to the FDA for review are accepted, and you might be happy to know that some of the claims are actually denied. So for example, claims related to lutein, and remember, lutein is going to be one of those pigments, yellow pigments, that is going to be found most visibly in corn. It's in spinach, but it's masked by the chlorophyll. So claims relating lutein to age-related macular degeneration have been denied in recent years, not because there's not some studies saying that they work, but they've been denied based on the strength of the evidence. Again, it's not that the evidence doesn't exist, but rather it's the type of research study and the determination of a successful endpoint. So for instance, what would this be for age-related macular degeneration, the prevention of blindness and the progression of disease? So are we looking at, okay, what's my successful endpoint here? So again, if I'm looking at age-related macular degeneration, do I have to prove that it actually prevents blindness? Or would a reduction in the progression of AMD be acceptable? So again, that agreed upon endpoint is very important. If you want to keep current on the status of these claims, and again, some claims are approved and some are denied, you can visit the FDA website and type in functional foods, or you can type in qualified health claim. Okay, cause and effect. Controversial issues arise with functional food in establishing a cause and effect relationship. And why is that the case? It's because many factors can influence food behaviors and mechanism in the human body. It is hard to determine if the food causes the positive effect because it could be related to something else. It could be related to genetics. It could be related to environment. It could be others that have played a role in disease prevention. So for example, would a food prevent diabetes in someone who's lean versus someone who's overweight? So again, there's lots of other confounding variables that make this a little bit difficult to do. Stricter guidelines should be in place to determine whether these health claims are really helping consumers or if they're adding to the confusion. In addition, will these functional ingredients all behave the same way? Omega-3 fatty acids, for example, are susceptible to oxidation. So are they going to behave the same way in a margarine versus juices versus a cereal? And again, I think that science is yet to be evolving. As consumers begin to buy into these functional foods, it's the job of the FDA and nutrition professionals like myself to ensure that the consumer is provided with the correct information. And again, always think about a whole food approach. Okay, frequently asked questions. As a healthcare professional and a mother, do you buy foods with functionality in mind? How much weight do I as a dietitian give claims to these foods? Well, first and foremost, I tend to look at the whole food and not an individual ingredient because we eat foods and not ingredients. But let me tell you what I may do. Say, for example, I have a client who absolutely does not like cold water fish. Cold water fish, as you might remember, is a great source of omega-3 fatty acids. Or they have a seafood allergy and they can't consume cold water fish. I might help them discover in the food supply some of these functional foods where they've actually added some omega-3 fatty acids to them. So for example, you can manipulate the omega-3 fatty acid content of eggs by what you feed the chicken. So I might have them turn towards a DHA modified egg in order to get some of their really beneficial omega-3 fatty acids. But keep in mind, since the science doesn't tell us, is it going to behave the same way in an egg as it would cold water fish, I probably would direct them to more than one different source to make sure that we don't have an over-reliance on a food where the bioavailability of DHA may not be as strong. How do I integrate functional foods into my family's diet? Is there a good place to begin? Well, although it seems like sometimes we need to eat mounds of food, the bottom line is you can actually think, okay, I'm going to go back to simple plate organization. What I'm going to do is choose my fruits and vegetables through the colors of the rainbow. And that is a really great place to integrate naturally occurring functional foods into the diet. Again, if that's not something that your family is going to buy into, you already eat a lot of fruits and vegetables, is there something else that you can do? And again, sometimes you can look at margarines and other cereals to see whether or not they have some functional ingredients added to them. Again, I hear all the time, do I really have to eat mounds of healthy food to acquire all the nutritional benefits? And you know what? Here's where common sense has to prevail. Keep in mind that your body needs to have a wide variety of nutrients, and we can't cram all these nutrients into a 24-hour environment. So what do? Maybe one day you get something that has yellow in it, and your plate's dominated by yellow. Well, the next day you just pick another color. Or even more importantly, maybe what you're doing is picking what's seasonal in your area. And keep in mind that over a period of time, maybe not within that 24-hour window, but over a period of time, you're going to get enough of these wonderful, good nutrients in your food. Because keep in mind, we have to watch our calorie intake. And so I think the challenge is that does the advent of functional foods help our situation, or does it muddy the waters? I always say whole foods first, And then if you want to fortify your food supply with some functionality, that's great. So let me go back and answer the question. Should you go out and buy those really expensive exotic berry juices? Well, here's a tip for you. If the blues and the reds are what confer the benefit, maybe you want to have grape juice or cranberry juice at a meal and save your money for that greater whole food approach. And thank you very much.